From the PEHSU National Program Office, welcome to Pediatric Environmental Health Radio, a podcast that highlights stories from leading experts in pediatric environmental health across the U.S. The PEHSU National Program Office supports a network of 10 regional PEHSUs across the nation whose vision is to create healthy environments for all children. For more information, go to PEHSU.net. I'm your host, Whitney Sturton Hall. Today I'm talking to two PEHSU experts, Erica Guerrero, who is a physician's assistant, and physician Dr. Mark Miller. Let's start with introductions. What are your current roles with the PEHSU and how long have you worked there? And Mark, let's start with you.
Yeah, thanks for having me on. I've been at the Western States PEHSU, Pediatric Environmental Health Specialty Unit. That's at University of California, San Francisco, and is part of the Federal Region 9 system, where we represent Hawaii, Arizona, Nevada, California, and the Pacific Islands. And I've been the director or co-director there for 20 years and am now Director Emeritus. I've been the lead for the Pediatric Oncology Clinical Education Supplement that we call Childhood Cancer in the Environment program. I've been the lead for the PEHSU network now for 3 years.
Great, thanks. And then Erica, would you like to introduce yourself?
Thank you, Whitney, for the invitation today. My name is Erica Guerrero. I've been with PEHSU Region 6, which is the Southwest Center for Pediatric Environmental Health, for 6 years. I actually started December 2018, so this is my work anniversary. Our PEHSU covers the states of Texas, Arkansas, Louisiana, Oklahoma, and New Mexico. We are hosted at Texas Tech University Health Science Center in El Paso. And I serve as one of the core collaborators for our region. I'm also the POSIS champion for Region 6.
Great. Well, thank you both for being here. Before we get into talking more about childhood cancer, the environment, and community health workers, what sparked your initial interest in environmental health and pediatrics? And Erica, let's start with you.
I received very little training on environmental health in PA school. This is pretty typical for medical professionals. When I was brought into the PEHSU by the previous regional director, Dr. Stephen Boron, I learned immensely about pediatric environmental health from him and also the current regional director, which is Dr. Stormy Monks. But what I think really sparked my interest in pediatric environmental health was preparing for and having my son. He's actually turning 4 soon. But I developed a heightened awareness of how a child's environment can significantly impact their health and development, especially since they're more vulnerable to toxins and pollutants compared to adults. From this point, I knew I wanted to be an advocate for children's environmental health.
Great, thanks for sharing. And Mark, what about you? What sparked your initial interest in environmental health and pediatrics?
Well, I think having been a kid that grew up in the 1960s and 70s, I was interested in the environment in general. But in my senior year in college, I had the opportunity to join a small group of scientists that went to Minamata, Japan, as a group that was invited by the Minamata Disease Victims Group. And this is the first large-scale industrial poisoning of the modern era, and mercury emitted from a chemical processing plant was released into the inland sea there and contaminated the fish, making many people sick, but particularly children that were exposed in utero. And I spent a week as a guest and visiting with people and learning about the story. And I think that represented to me and to the victims the potential future for the population of the earth, and that if I was going to devote energy to something over my lifetime that I could look back if I worked on children's environmental health and feel like I'd done something of value toward a more positive situation.
Wow, yeah, I had never even heard of that. Mark, as the founder of PEHSU's Childhood Cancer and the Environment Project, can you give us some background on what the current focus is of POCI? So that stands for Pediatric Oncology Clinician Education Supplement. So your current focus this year, who's involved in the work, and if you want to give any kind of background context, you're welcome to do that as well.
Yeah, the project developed 3 years ago with federal funding that is a result of Trevor's Law, in part brought on by a young man who had a brain tumor and successfully has fought that and is a survivor. And he and his mother had identified concern about, were there excess childhood cancers in their area? And they thought that as a country we could be doing more to identify risk factors for childhood cancer. And on top of that, we had noticed in a project that I was involved in called the Center for Integrative Research on Childhood Leukemia and the Environment at UC Berkeley that there was relatively little education of clinicians, and this is across the board: nurses, physicians, health educators, physicians' assistants, etc. That there was relatively little attention paid to environmental hazards at all, and particularly those related to childhood cancers. So when we started the program, we started at home. In other words, this is a program of the PEHSU network, and we had an extensive training program where we developed a champion from each of the 10 PEHSUs in the country that would have an extra training and focus on childhood cancer and the environment. And then we developed a curriculum both for their training and then for training others involved in pediatric care and potentially OBGYN care with expert researchers. And we trained a vanguard group of hematology oncology, pediatric hematology oncology fellows and nurse practitioners in a couple of separate large trainings. This was all done in the first year of the program. In the second year, we developed a focus additionally on community health workers and promotoras de salud, which Erica will talk more about. But in that year, we developed a curriculum for those health promoters. And we then also identified with the help of a parent advocate that in care of children with cancer, the parents often had questions that the care providers really felt like they didn't know how to answer, since they hadn't really had training in environmental health as relates to childhood cancer, or really any environmental health training to speak of otherwise, that they were then uncomfortable. We had done a survey of providers, and the vast majority said that they, in fact, were not comfortable answering these kinds of questions. And on the positive side, though, they were very interested. More than 90% said they would really like to know more. So we developed this program to help pediatric oncology centers provide a consultative service on environmental health. In other words, trained people that would be able to answer some of parents' questions about should they worry about X, Y, or Z issue with environmental health, and provide guidance for reducing children's exposures to possible carcinogens. So we trained physicians, nurses, and social workers at Baylor Medical College, Texas Children's Hospital. And they have become the first consultative service in pediatric environmental health in a pediatric oncology setting in the United States. We're extending these programs by having more work with community health workers, and also by training our second pediatric oncology center at Mercy Hospital in Kansas City in helping them develop a consultative service on environmental health.
Amazing. Such important work, and really wonderful to hear your impact as well. So Erica, you're the POHSU champion for Region 6. Let's talk about your work with community health workers and childhood cancer in the environment. So what kind of populations do you serve, and then who are the typical community health workers you work with?
If you don't mind, Whitney, I would like to first describe a community health worker for those who are unfamiliar with the profession. So a community health worker, or a CHW, are trusted members of the community who work to improve health and reduce health disparities. They usually live in the same community as they work, so they share very similar life experiences, socioeconomic status, ethnicity, and language with the people that they serve. So it's really easy for them to go out and talk to their neighbors about different issues. And there's many different names that are used for CHWs. Our region is along the U.S. Mexico border, but we work with promotoras or promotores de salud, which are health promoters in English. And they work with low-income and underserved areas, which can be hard to reach or closed off to other healthcare professionals. So our region has actually been working with community health workers for a fairly long time, and with the different projects that we've had, we see the benefit of using these professionals to go out and teach community members about different initiatives that we have.
And then what are some trends you tend to see when it comes to community health workers educating local populations about cancer and environmental risks?
So it's really interesting. We started collecting data during our training sessions with community health workers just to determine if there was any attitude changes, or determine if the training that we were providing was well received by the participants. But most of the community health workers, about 71% of them, had not been educated on childhood cancer in the environment. And once they received the training, we saw significant changes in how they perceive the environment in childhood cancer. We provided a pre and post survey during the training sessions. And the pre-survey, one of the questions was if they agree that environmental exposures had a potential contribution to childhood cancer. And 59% strongly agreed with this, but that later changed to 90% after the training. Another question that we asked was that if they thought children were more vulnerable to the environment. And before the training, 78% thought strongly agreed with this statement, and that later changed to 96%. Another question that we asked is if we minimize environmental exposures, if that would reduce the risk of childhood cancer. And 80% said that before the training, and that later increased to 96%. But I think the final question is very telling to the importance of our training and what we're doing, is that community health workers felt more confident after the training to educate others about environmental exposures and childhood cancer. And that changed from 52% to 89%.
Amazing. Yeah, those are significant changes in those numbers. Thanks for sharing that. A question for both of you now, maybe we can start with Mark, is what is a standout lesson you've learned or a key impactful moment you've had that comes to mind when working on childhood cancer in the environment?
one thing that comes up is that in speaking with pediatric oncology providers, there's always a concern that bringing up issues that may have been a risk factor that might be associated with a child developing a cancer will cause their families to have excessive guilt about that. And what we've learned is that really isn't the case, that in fact the feedback we've heard from families is that it doesn't increase their guilt and makes them feel, in fact, less concerned about whether there's a guilt involved at all. And that survey of providers at Baylor said, yes, in fact, they would like to use and would use the consultative service, and that they didn't have a problem with that, which is part of being able to answer people's questions. That parents have said that, we looked for, we were concerned about these issues, and we weren't finding anybody who was willing to talk to us about that. They provide all kinds of other kinds of consultative service. If you wanted to see a psychologist or art therapist or any number of physical therapists or regular therapists. But when it came to answering questions about environmental exposures, they said, well, we don't really know about that, or they just blew it off as not important. And parents were able to read for themselves that there were these associations in the literature. But understanding what the literature says, in fact, is able to help clinicians discuss these issues in a way that results in more knowledge and understanding that though some factor and things that have been associated, for example, with childhood cancers are exposure to tobacco, pesticides, solvents, and air pollution. So even though those are risk factors, when we look at a population, a whole group of children in a community, 100,000, 1 million children, that we can see that there's some increased risk. In fact, all the children have these exposures, and only a very few get childhood cancer. So that having these exposures is in fact both unavoidable and only rarely contributes to childhood cancer risk. On top of that, there are exposures that reduce risk, and that's helpful to know that, for example, adequate folic acid, either as supplements prenatally or in the diet, or breastfeeding. Those are things that people can do that, in fact, reduce the risk of childhood cancer.
Thanks, Mark. I love hearing, what people can do as well. That's really helpful. Erica, what about you? What's a standout lesson you've learned or a key impactful moment you've had that comes to mind working on this?
I think the most impactful moment with the POSES project has been working with the community health workers. And I think this is because we've been intimately involved with this group, but they have a very long history of making positive impact with their communities, and there's decades of research on the effectiveness of using the profession. Our region teamed up with the Promotora group in El Paso to provide education to community members on pediatric cancer and the environment, and they used the flip books that we developed for the project. And we had an agreement with them. We decided collectively on a number to train, and this group far exceeded our expectations. And they trained more than 548 community members in less than 2 months. And I think this really highlights the value of this profession in working with the Promotora model.
Amazing. Well, as a mom, Erica, maybe you want to, tailor this to other parents or community health workers. But if you could give a caregiver, parent, a health provider, or community health worker one piece of advice about childhood cancer and the environment, what would it be?
My advice would be that we all have the power to affect change for health of our environment and the health of our children by making simple and mindful changes. And first, it takes the knowledge of the environmental hazard, which primarily comes from a trusted voice like a healthcare provider or community health worker. And then you can see that this advice trickles down from the parent or caregiver to the child. And it could be a simple change. It doesn't have to be something very drastic. And that could be just simply taking off your shoes at the front door so dust isn't tracked through the home.
I think there are simple things that people can do to reduce their exposures to environmental hazards, including ones that are risk factors for childhood cancer. So again, these include things like tobacco, pesticides, solvents, and air pollution, and a simple measure like the one Erica just suggested about taking off or cleaning your shoes before entering the house, that helps you to not track in pesticides or other chemicals from the outdoors into the house. It's an example of how simple actions that are cost free can reduce your children's exposures. Another one is washing your hands before eating. You children get dust on their hands or dirt on their hands that often includes a variety of different chemicals. Washing your hands with soap and water, simple action before eating, it helps to reduce that, their hands contaminating their food with these chemicals and then them ingesting them.
I love the focus on small, kind of simple actions you can take that can help across the board. For people with more questions on childhood cancer and the environment, how do they get in contact with you or who you work with, and what are some tools and resources available to the public, and where can they find them? And I'll put things in the show notes as well, but it would be great to hear you both kind of reference what stands out to you.
Yeah, depending on people's level of scientific knowledge and interest in the topic, we have developed things like a simple fact sheet for families and communities about childhood cancer and the environment. We also have videos that are, more complex, meant for people with a science background, including clinicians, on epidemiology and other factors that are the background for why we're doing this program. We have a comic book in English and in Spanish that's available, that's for any level of reading, and it's called Rosa y Carlos se casan. Rosa and Carlos get married. It has recipes in it. It's a fun piece of educational material that is in the form of a comic book and very, very accessible. And all of these and other materials are available on the Western States PEHSU website.
Mark's website is definitely the best repository of resources on childhood cancer and the environment, which is the Western States PEHSU. But if you just want general knowledge on pediatric environmental health, the best way to reach your PEHSU is through the national website, which is PEHSU.net. And you could find an expert with the interactive map. For example, if you're in Texas and you select Region 6, there is a hyperlink that would take you to our website at the Southwest Center for Pediatric Environmental Health. And we have a bunch of resources as well. And we also have our toll-free number and email address that you could contact us on the website.
Additional materials that the PEHSUs have available is the Pediatric Environmental Health Toolkit. It's a product of the PEHSU network. It's an online toolkit of where you can look up particular types of chemicals, and it has information about how you get exposed to them, as well as preventive measures you can take to reduce exposure. For clinicians and for the science literate, we have the Story of Health ebook, multimedia ebook that has very in-depth information on various topics. There is one of the chapters, Stephen's Story, which is about childhood cancer and the environment, and has extensive amount of material that will be released soon in a Spanish version as well. And all of these are available on the Western States PEHSU website. There's also great materials, as Erica mentioned, on her website, but actually on all the PEHSU's websites and the National PEHSU Network website. Many, if not all, of the environmental factors that have been found to be associated with increasing risk of childhood cancer are also connected with many other health outcomes. So, for example, air pollution. Besides childhood cancer, air pollution is associated with respiratory health, asthma, and neurocognitive development. Tobacco is related with birth outcomes, pesticides, a great many of hazards, including decreased IQ. So these are all things that, besides the small increase in risk for childhood cancer associated with them, are associated with many other things that you would like to reduce your children's risk to. Similarly, the factors, the exposure factors that are associated with reducing the risk of childhood cancer, for example, adequate folate or folic acid before conception and early in the pregnancy in your diet or as supplemental vitamins, that's also associated with decreasing the risk for neural tube defects, a birth defect, and autism. So it's not just childhood cancer. These are the things that one would do to reduce risks for childhood cancer are also things that you should do for many other reasons related to the health of your children.
Thank you to our guests, Dr. Mark Miller and PA Erica Guerrero, and all of you for tuning in to Pediatric Environmental Health Radio. This podcast is a project of the PEHSU National Program Office, supported by the U.S. Centers for Disease Control and Prevention's Agency for Toxic Substances and Disease Registry and the U.S. Environmental Protection Agency. The Public Health Institute serves as the National Program Office with advisory support from the Association of Occupational and Environmental Clinics. The findings and conclusions in this presentation have not been formally disseminated by CDC, ATSDR, or EPA, and should not be construed to represent any agency determination or policy. Use of trade names that may be mentioned is for identification only and does not imply endorsement by the CDC, ATSDR, or EPA. Please join us next time as we share more pediatric environmental health stories. To learn more about our program, find resources, and see how we are making meaningful contributions to pediatric environmental health, visit our website at pehsu.net. This podcast is produced by Whitney Sturton Hall. Our graphic element was drawn by Robin Hall, and our theme music is by Roman Kano.